Hello, everybody. My name is Biju John. I'm a psychiatrist in the state of California in Sacramento, and I've been asked by the Malayali Association here to talk a little bit about mental health during this time of difficulties with the coronavirus. So let me begin by just talking about some general things. Okay, now our Kerala community is very well known around the world for being a very sincere, hardworking community. Now, the problem with that is that sometimes we are shy to talk about our needs. For example, during this time when our employers should be also be protecting us when we are working, there may be some deficiencies, and we don't want to be shy to talk to our supervisors about things that we feel they should be doing for us. And this is especially true if we have any kind of health conditions. For example, a history of heart disease, asthma, bronchitis, blood pressure problems, and so on. So if there are some significant chronic health diseases that we have, it's probably a good idea to go see the doctor and get a letter and even consider an FMLA kind of a situation that would help you in the future if for some reason you need to miss some time off of work. So that is the first thing that I would tell people, especially if they are relatively new to this country and they don't really know how the workers' rights work in this country. The second thing that I want to point out is the government has some programs that helps us financially. For example, right now they have this program where a lot of banks are willing to defer mortgages. Now, my suggestion to you all would be to look into those programs to see if you qualify for them, because it's good to have some money on hand if someone were to fall sick. God forbid. And because, you never know when people might need to go to the hospital, and the insurance, of course, covers for most of the losses, but we need to have some cash on hand. So look at the programs that the government offers so that we can make sure that we have some cash on hand. The next thing that I want to talk about is the general mental health conditions. Okay, so just a little summary of what kind of mental health conditions people can have during this time. The most common conditions that people might have are depression and anxiety, and the way that manifests is people can get irritable, they can get short-tempered, they can be easy to get into fights with, they may have trouble sleeping, they may be constantly thinking about what can happen if the coronavirus strikes us. So they're constantly obsessing over things that happen or can happen. And so my suggestion to everybody would be prevent information overload. Okay, so it's good to be aware of what's going on, but that only takes 5, 10, or maybe 15 minutes a day to really understand what's going on in the world. But there are people who just read about this, read the news, read WhatsApp messages, all about coronavirus for hours and hours together. And so that bothers them, that interferes with their sleep, that affects their work, it affects their ability to concentrate. And so it's important that we are careful about information overload. So how do we identify our family members who are having difficulty with anxiety and depression? Like I said, you would find that they are having problems in terms of how they interact with us. They may appear preoccupied. So how do we prevent that? Well, it's good to have a structure in the day, be it the kids or be it the adults who are mostly working from home. You have to have a structure in your day. You try to have a regular time when you go to bed and when you wake up in the morning, and you pretend as if you're going to work, which is you change into nice clothes, you have your breakfast at the regular time, and then make sure that you take breaks during your work from home times, and you protect your back and your body from ergonomic problems. As you may know, if you don't have a good place to sit, that results in other medical issues. So these are all tied in together. When you don't feel good physically, then you don't feel well emotionally. So my suggestion is for spouses who are working from home, you need some time together, but you also need some time apart from each other. Otherwise, you might end up getting on each other's nerves. Similarly, the kids who are at home from college, it's a very new kind of situation, because you're used to kind of going out with friends, eating out, and studying together, sometimes late into the night. And here you are back at home, and you now need to have the discipline to kind of conform to the rules of the home. So be aware of how all this changes, okay? And be flexible with each other. A special word for those aunties and uncles who are like my parents, who are living with families, the elderly people, the ones who are in their 70s and in their 80s. You are especially vulnerable to the coronavirus, but you're also especially vulnerable to the mental health issues that go along with it. It is very important that we stay connected with everyone else in the family. And by connected, I mean that we eat together, we pray together, but by the same token, it's very important for the children especially that they are practicing social distancing. Now, many of the deaths that happened in Italy happened because the little ones, the teenagers, they would go hug their grandmothers right after they come out playing with their friends, and would unknowingly transmit the coronavirus to their grandparents. So it's very important for all of us to follow the rules so that we protect the most vulnerable amongst us, who are our grandparents. So please remember that, children. One other suggestion that I had was, when we adults talk to our loved ones in India, please remember that India is also going through a somewhat similar situation that we are going through, and it affects our parents and other elderly relatives in a way where they may start losing hope, they may start getting anxious and depressed themselves. So in our phone calls with them, it is important that we stay positive and that we encourage them to think positive thoughts and not look at worst case scenarios, because then it would affect their health, it would affect their emotional health, it will affect their physical health, which would then affect their immunity. So please call our loved ones in India and help them stay positive. Now, before I end, I would want to appeal to our youngsters to please follow the rules in terms of social distancing so that you can protect yourselves and your loved ones, and especially the elderly people in your family. Thank you for your attention. Bye-bye.